an entry ban over Omicron. Israel closes its borders to foreigners. Most Israelis have already been vaccinated twice or even 3 times. But initial studies suggest the new virus variant is circumventing some vaccines. That means even vaccinated individuals can become infected. Omicron is causing a dramatic rise in infections in South Africa. BioNTech researchers are already developing a vaccine against the Omicron variant, available in March. Welcome, I'm Ben Fazulin. South Africa discovered the new variant, but that doesn't mean Omicron originated there. It's more a sign of the country's prowess in gene sequencing. We'll talk about that with virus hunter Emma Hodcroft in a moment. First, this report.
Stranded travelers, plunging stock markets, new lockdowns. Call it the Omicron effect. The variant was first identified by South African researchers. Lab workers running COVID-19 tests started to find cases that didn't match known virus profiles. So they alerted virologists who studied the virus's composition by sequencing its genes. Sequencing is a tool that allows scientists to follow how a virus mutates. That means they analyze genetic material by reading its components, each one like a letter of the alphabet. South Africa has highly advanced sequencing labs, a legacy of the HIV and tuberculosis epidemics, which saw the country develop significant testing capabilities, now directed toward coronavirus research. But there's a downside. Many countries instituted travel bans on South Africa as soon as Omicron was revealed. Some say that the country is now being punished for its transparency and its research. But will such travel bans even work?
When you are kind of taking measure against a country, it is like it is the measure against a good surveillance system. So the fact that other cases are being discovered in Europe is not unexpected. It may happen in other countries.
Those travel bans are still in place, however, even though the virus is known to have already traveled all over the world.
And now to molecular epidemiologist Emma Hodcroft. Thanks for your time. Tell us more about how sequencing actually works and how you draw real-life conclusions from mutations.
So mutation is really a way of life for viruses. They mutate quite a lot. Importantly, most of these mutations won't impact how the virus works, but they're important clues that we scientists can use, because if we see 2 viruses that have similar mutations, they're probably more closely related. And when we analyze all of the sequences of SARS-CoV-2 that are available, we can basically make a virus family tree. This lets us trace how the virus has moved around the world, how it's changed over time, and perhaps most importantly, how it's acquired new mutations that could indicate the virus is changing how it works.
So how related would you say Omicron and Delta are?
So one of the things that surprised scientists about Omicron is that it's actually very distantly related from any other variant we've seen so far. I think many of us expected that the next variant would be kind of a child of Delta, Delta plus something else. But Omicron has come a little bit out of left field. We don't actually have many ancestors for Omicron, so relatives nearby that help us understand where it came from or how it came to be so different. This is something we're hoping to understand better as we get more data.
What does the mutational profile of Omicron tell us about its transmissibility or immune evasiveness?
So what really surprised scientists with Omicron is that it has a lot of mutations in what we call the spike protein. And many people will have heard of this. It's the part of the virus on the outside that's critical both for the virus to actually attach to cells and infect them, but also it's the part that our immune system learns to recognize when we've been infected or vaccinated, so that if it sees it again, it mounts a good immune response. Because Omicron has so many mutations, there's real concerns that this could mean the virus might, for example, be able to get into cells faster, or it might have changed so much that our immune system doesn't recognize it as well. And unfortunately, some early data that came out a few days ago suggests that immune protection and the protection from vaccines might be lessened for Omicron. This is why scientists are working really hard to try and better understand how well protected from Omicron we are and whether it is more transmissible.
But we're being told that Omicron doesn't cause such a severe course of COVID-19 in people. Could it be a good thing at the end of the day if Omicron overtakes Delta, which is by most studies more dangerous?
So one thing we need to be really cautious here is that we've only identified Omicron a couple of weeks ago. The data is incredibly early, especially for things like hospitalization. If you get SARS-CoV-2, you don't go to hospital the next day. It might take a couple of weeks until we know that you're having a bad outcome. So we might just not be seeing this yet for Omicron. But even if Omicron does have a slightly less bad clinical outcome, so maybe slightly fewer people end up going to hospital, what's still really concerning is that if it transmits really quickly and it can get around vaccine immunity, a lot of people will get infected at about the same time. So we'll have a huge number of cases. And even a small percent of a big number is a big number. So if a lot of those people end up needing hospitalization and care at the same time, that could still overwhelm our healthcare systems.
What does its genetic code tell us about its potential origin? Because you mentioned there's a big question mark over that at the moment.
So the interesting thing about Omicron, as I said, is that it doesn't have many near relatives. Normally, when we identify a variant, we can kind of see its grandparents and its great-grandparents and how it might have come about, how it changed over time. With Omicron, we don't really see this, but scientists have some ideas about why Omicron might be so different. For example, it could be that it evolved in an immunocompromised person. When someone's immune system doesn't work as well, they can't clear the virus quite as quickly, and it can acquire a lot of mutations. Another idea is that it could have been circulating somewhere just undetected. As you mentioned, we don't have good surveillance everywhere in the world, so it might have grown up somewhere else and only been picked up when it moved into South Africa. Finally, there's some speculation that this could have been a variant that moved into an animal host and then jumped back into humans. But it's important to note we haven't seen this happen in SARS-CoV-2, where the virus that came back to humans was actually worked better in humans. In the past, it's generally adapted to the animal. Of course, that doesn't rule out that could be what's happened here. And it could be a combination of two or more of these things together.
And Emma, can you predict whether or not Omicron is here to stay? Because only a few variants have managed to stay around.
So this is a really good point. We see a lot of variants emerging with SARS-CoV-2. Some of them become more well-known than others, but most of these were completely wiped out by Delta, actually. It's still early days, so it's hard to know exactly what impact Omicron is going to have. Certainly at the moment, we see it growing at quite a fast rate, both in South Africa and in countries in Europe that have good surveillance systems. So this implies that it could overtake Delta. On the other hand, we have a lot more Delta here in Europe than they do in South Africa. So it might be that this slows Omicron down a little bit. The more data we get over the next few weeks, we'll get a better idea of what Omicron has in store for us.
Lastly and briefly, which genetic signs would make you suspicious regarding the evolution of a new variant?
So mostly what we look for in new variants is changes in the spike protein. And things like Omicron are exactly what we've been watching out for, where we see a lot of mutations in areas that our body needs to recognize the virus, and areas that might impact how fast that virus can spread from person to person. So this is what we're really looking out for when we look at new sequences that are arriving from all around the world.
Emma Hogcroft, pleasure talking to you again. And here's a great question to follow up on that chat with Derek Williams, boosters tailored to variants. We touched on it earlier.
Is anyone already working on a booster tailored specifically to the new variant?
Yes, pretty much all of the companies that make COVID-19 vaccines say that they have plans in place to respond to Omicron with tweaks to their products if the new variant proves to be good at getting around immune defenses in people who are vaccinated. But we don't know yet whether or to what extent that'll be the case. A lot of scientists do expect that the high number of mutations in the variant's spike protein will probably translate into it being better at shaking off antibodies programmed by vaccines to stop earlier versions of the virus. But they're just one factor in the equation. Antibodies aren't the only layer of defense in the immune system, and other layers might pick up some potential slack, or at least enough to keep vaccinated people from getting severely ill. If authorities decide vaccines do need tweaking, then manufacturers of approved messenger RNA vaccines will likely be the fastest out of the blocks. Both Pfizer and BioNTech and Moderna say they could be ready to begin producing doses tailored to Omicron on a massive scale by about March. But don't forget, the bigger problem by far, for now at least, continues to be the Delta variant, and the vaccines we already have still work well against it, especially healthcare authorities say after a booster shot, which raises the number of antibodies in your body significantly, at least for a while. And that increase in quantity, some experts think, might help make up for any potential loss of quality when it comes to the new variant. So for the time being, they say, the right strategy is to continue to give people boosters of available vaccines and wait for more data on Omicron before moving to alter them.